Asthma is a medical condition in which certain things can trigger a physical reaction in the lungs and make it difficult to breathe. A person with asthma may need help assembling and using their inhaler. After completing this lesson, you should be able to describe how to recognize and provide first aid for asthma.
Asthma is a medical condition in which certain things can trigger a physical reaction in the lungs and make it difficult to breathe. Asthma triggers include allergens such as pollen and molds, irritants such as smoke, fumes, and dust, medications such as aspirin or acetaminophen, extreme weather conditions, and exercise or stress. When symptoms get worse, it is called an asthma attack. In an asthma attack, the small airways in the lungs narrow due to swelling and the production of mucus. Airflow into and out of the lungs is restricted. The person may wheeze, cough, or feel tightness in their chest. The symptoms can range from mild to severe.
Hey man, are you okay?
I took a couple trips upstairs. I think I'm having an asthma attack.
Do you have an inhaler?
Yeah, it's in my bag.
Okay, just take a seat.
A person with asthma may use a metered dose inhaler to deliver a quick relief medication to help control symptoms. Occasionally, due to the degree of difficulty breathing, the person may need help assembling and using an inhaler. Allow the person to find the most comfortable position in which to breathe, typically sitting up and leaning forward. With consent, help them loosen any restrictive clothing. Help the person assemble and use the inhaler. To use an inhaler, first, take the cap off. Look inside the mouthpiece and make sure there is nothing in it. Shake the inhaler hard 10 to 15 times before each use. Have the person breathe out all the way. Encourage them to push out as much air as they can. Hold the inhaler with the mouthpiece down. Have them place the mouthpiece between their teeth and close their lips around the mouthpiece to make a tight seal. As they start to slowly breathe in, press down on the inhaler one time. Have them keep breathing in as slowly and deeply as they can. Have them take the inhaler out of their mouth, and if they can, hold their breath for a slow count of 10. This lets the medicine reach deep into the lungs. Have the person pucker their lips and breathe out slowly through their mouth. If more than one dose is needed, repeat the steps. Follow the same steps to use an inhaler with a spacer by first attaching the spacer to the inhaler mouthpiece. Call 911 to activate EMS using a mobile device or activate your EAP, and get the first aid kit and AED if the person does not have their inhaler, gets no better or gets worse after using their inhaler, has difficulty speaking, or becomes unresponsive. Be prepared to provide CPR if the person becomes unresponsive and stops breathing, or is only occasionally gasping or makes snorting, snoring, or gurgling sounds.
Complete this review question to check your knowledge.
Your favorite fantasies are now together in perfect harmony.
A severe allergic reaction can develop rapidly. Without treatment, death can occur within minutes. After completing this lesson, you should be able to explain how to recognize and provide first aid for a severe allergic reaction. Explain how to use an EpiPen epinephrine autoinjector.
A severe allergic reaction, known as anaphylaxis, is an extreme response of the body's immune system to something that it is sensitive to. Common things can initiate a severe reaction, including bee stings, peanuts, latex, seafood, and penicillin. When anaphylaxis occurs, the airway can become constricted due to swelling of the throat, making it difficult to breathe. Wheezing may be heard. Swelling of the lips, eyelids, and face may occur. Itchy raised lumps or hives can appear on the face and chest. The person may complain of nausea and abdominal cramping. Their voice may sound hoarse. A severe allergic reaction can develop rapidly. In general, the faster the reaction occurs, the more severe it is. Without treatment, death can occur within minutes.
Hey man, are you okay?
Yeah, something's wrong.
Are you allergic to anything?
Yeah.
Are you allergic to latex? Hey, do you have an EpiPen?
Yeah, in my car.
Here, have a seat. I'll be right back.
Assess scene safety and take standard precautions. Assess responsiveness. Activate EMS and/or your EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED. Assess breathing for no more than 10 seconds. Follow the procedure based on your findings. If the person is breathing and appears responsive, obtain consent. A person with a history of allergic reactions may carry an epinephrine autoinjector that has been prescribed to them. Autoinjectors use a spring-loaded needle to rapidly administer a measured, single dose of epinephrine. Epinephrine can quickly reverse the effects of the reaction and may be life-saving. If a person is unable to self-administer an injection, the first aid provider may be able to do it for them. Individual state laws and regulations may allow laypersons to obtain and administer epinephrine for a person experiencing anaphylaxis, but may prescribe specific practices, rules, and standards for epinephrine autoinjector administration. The EpiPen autoinjector is a commonly used epinephrine delivery device. Available in both adult and child doses, it is designed to work through clothing. Remove the EpiPen autoinjector from the carrier tube and check the autoinjector to make sure the blue safety release is not raised. If the blue safety release is not raised, the autoinjector is okay to use. Grasp the autoinjector in your fist with the orange tip, the needle end pointing downward. With your other hand, remove the blue safety release by pulling straight up without bending or twisting it. To avoid accidental injection, never put your thumb, fingers, or hand over the orange tip. Place the orange tip against the middle of the outer thigh at a right angle to the thigh. Swing and push the autoinjector firmly until it clicks. The click signals that the injection has started. Hold firmly in place for 3 seconds. Count slowly. 1, 2, 3. The injection is now complete. Remove the autoinjector from the thigh. The orange tip will extend to cover the needle. If the needle is still visible, do not attempt to reuse it. Massage the injection area for 10 seconds. Activate EMS or your EAP if you haven't done so already. Consider giving a second dose with a new epinephrine autoinjector. If one is available, symptoms persist, and EMS is still 5 to 10 minutes away. Regularly reassess scene safety, responsiveness, breathing, and the effectiveness of first aid care provided. Stay with the person until someone with more advanced training takes over or EMS arrives. Give the used autoinjector to EMS providers for proper disposal, or follow your employer's bloodborne pathogens exposure control plan.
Complete this review question to check your knowledge. A person who is having a heart attack may deny it. Delays to medical care can jeopardize life. After completing this lesson, you should be able to describe how to recognize and provide first aid for heart attack.
Acute coronary syndrome is a medical term used to cover a broad range of conditions where the blood and oxygen supply to the heart muscle is suddenly blocked. One such condition is a myocardial infarction, commonly known as a heart attack. The myocardium refers to the muscular tissue of the heart. The word infarction comes from Latin and means to plug up or cram. This cramming is typically caused by arteriosclerosis, a chronic disease that causes plaque, cholesterol, and other substances found in the blood to thicken, harden, and narrow the coronary arteries. When the pre-existing coronary artery plaque breaks, a blood clot forms and lodges in the blood vessel, blocking the flow of blood and oxygen to the heart muscle, causing a heart attack. Less commonly, a severe spasm or sudden contraction of a coronary artery can stop blood flow to the heart muscle. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. The symptoms of a heart attack vary from person to person. Heart attacks can start slowly and cause only mild pain or discomfort. Symptoms can be mild or more intense and sudden. Symptoms also may come and go over several hours. The most common symptom is chest pain or discomfort. Other symptoms include upper body discomfort, such as pain or discomfort in the left arm, both arms, the upper back, neck, jaw, or stomach. Shortness of breath, feeling weak, lightheaded, or faint, and cold, clammy, sweaty skin can occur with heart attack, as well as nausea and vomiting. Women are somewhat more likely to have shortness of breath, nausea and vomiting, unusual tiredness, sometimes for days, and pain in the back, shoulders, and jaw.
What's going on? Help!
Sudden cardiac arrest, or SCA, occurs when the normal electrical impulses in the heart cause it to beat too quickly, inefficiently, or in an unsynchronized manner. SCA results from a problem with the heart's electrical system. With SCA, the heart suddenly and unexpectedly stops beating. Blood flow to the body, along with the oxygen it carries, abruptly stops. Cardiac arrest happens suddenly, and often without any warning signs. A victim of SCA will be unconscious, unresponsive, and not breathing normally or only gasping. With a heart attack, the heart generally continues to beat, despite the blockage, and the person remains conscious and responsive. A person who is having a heart attack may deny it.
Something's wrong.
What's
I
going on,
think we
sir?
need to help.
I'm okay. I just don't feel very good.
But delays to medical care can jeopardize the person's life. Assess scene safety and take standard precautions. Assess responsiveness. Activate EMS and/or EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. Assess breathing for no more than 10 seconds. Follow the procedure based on your findings. If the person is breathing and appears responsive, obtain consent.
Okay, yeah, Control. Hey, can we activate the emergency action plan? And I'm gonna need an AED as well. We're located by the bird cages, and we're sitting on a bench right now. He looks like he's looks like he's having chest pain.
Calm, comfort, and reassure the person. With consent, loosen any tight clothing. Allow them to find a comfortable position.
Is there aspirin in here?
Yes, right on. Yes, we have a white male. How old is this? 45.
The early administration of aspirin for heart attack can be life-saving, unless the person has a known allergy to aspirin or has been advised by a healthcare provider not to take aspirin. Encourage the person to take aspirin. Aspirin can help prevent blood clots from forming in coronary arteries and can reduce heart damage. The suggested dose is 1 adult 325 milligram tablet or 2 to 4 low-dose baby aspirins, 81 milligrams each, chewed and swallowed. The aspirin should not be coated. Stay with the person until someone with more advanced training takes over or EMS arrives. Be prepared for the possibility of sudden cardiac arrest and the need for CPR and the use of an AED.
Complete this review question to check your knowledge.
Certified technicians. Is that important? Well, you wouldn't hire just anyone to help you move, would you? No, of course not. Not again.
Get your Toyota ready for the year's coldest and harshest weather. See your New England Toyota dealer for great service offers to help keep your Toyota dependable and fuel efficient all winter long. Toyota Service Centers. Keep your Toyota a Toyota.
A stroke can cause lasting brain damage, long-term disability, or even death. After completing this lesson, you should be able to describe how to recognize and provide first aid for stroke.
A stroke, sometimes called a brain attack, occurs when the blood supply to a portion of the brain is suddenly interrupted.
Help! Somebody, we need help!
This most commonly occurs when a blood clot obstructs a blood vessel in the brain, such as an ischemic stroke. A stroke can also occur when a weak spot in a blood vessel wall, known as an aneurysm, bursts open and bleeds into surrounding brain tissue. In either case, parts of the brain become damaged or die. A stroke can cause lasting brain damage, long-term disability, or even death. Assess scene safety and take standard precautions. Assess responsiveness. Activate EMS and/or your EAP. Send someone to get a first aid kit and AED. Assess breathing for no more than 10 seconds. Follow the procedure based on your findings. If the person is breathing and appears responsive, obtain consent.
Sir? Madam? I'm Ellen and I work for the winery. Is something wrong?
I don't know what happened to him.
I can help.
Use the memory aid FAST to recognize the warning signs of stroke.
Sir, can you try and do a few things for me?
Face. Ask the person to smile. Does one side of the face droop?
Okay, can you smile for me? Smile big if you can.
Arms. Ask the person to raise both arms.
Good, that's good. Now can you raise your arms?
Does one arm drift downward?
Okay, just one more thing.
Speech. Ask the person to repeat a simple phrase.
Can you tell me your name?
Is the speech slurred or strange? time. If you see any of these signs, it is time to activate EMS or your EAP.
Troy, go call 911 and tell them we have an emergency and bring back the AED.
After activating, and unless they are readily available to you, send someone to get the first aid kit and AED.
Sir, we're going to get you some help. I'm going to stay right here with you until help comes, okay?
Unlike a suspected heart attack, do not give aspirin for a suspected stroke. As a blood thinner, aspirin can increase bleeding and potentially worsen a stroke. As there is no clear benefit, first aid providers should not give supplemental oxygen to a person with a suspected stroke. Regularly reassess scene safety, responsiveness, and breathing. Stay with the person until someone with more advanced training takes over or EMS arrives.
Complete this review question to check your knowledge.
Does organized crime have anything on Mason Simonian? He appears to be a high-level target. Lots of open investigations. Case agent who's been tracking him's here in the building. We want to talk to her? Yeah, Tyler might be beneficial for both of us. Mason Simonian is a dangerous man. You think he's capable of murder? He might be good for the killing of the family in Queens? 100%. Take a look. What kind of animal would do something like that? We think he's good for 5 or 6 other unsolved murders, too. But so far, he's managed to stay out of reach.
We looked at this guy's record. He's got plenty of priors, drug sales, sex trafficking.
For most seizures, basic seizure first aid is all that is needed. After completing this lesson, you should be able to describe how to recognize and provide first aid for seizures.
Eduardo!
Generalized seizures are triggered by excessive electrical activity within the brain.
Hey! Somebody help! Help!
Symptoms may include sustained rhythmic jerking movements, muscles becoming weak or limp, tense or rigid. There may be brief muscle twitching, or the body may flex and extend repeatedly. While there are many conditions that can cause a seizure to occur, the care provided is always the same.
I can help.
Assess scene safety. If the scene appears unsafe, do not approach it. Take standard precautions. Assess responsiveness. If the victim appears unconscious, tap them and ask loudly, "Are you okay?"
Get the first aid kit and AED from the break room.
Okay.
After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. Assess breathing for no more than 10 seconds. If an unresponsive person having a seizure is not breathing normally, or only gasping, immediately start CPR. Loosen tight clothes around the neck and put something small and soft under the head. Do not put any objects in the person's mouth, including your fingers. It's physically impossible for someone to swallow their tongue. Protect the person from injury during the seizure. Move objects away that they may bump into. Do not restrain them. Time the length of seizure. Remain calm. Most seizures last only a short time and stop without any special treatment. Place the person in the recovery position and stay with them until they are awake and alert after the seizure. Call 911 to activate EMS using a mobile device, or activate your EAP if the seizure lasts longer than 5 minutes, or if the person is not breathing normally or only gasping, has difficulty breathing, is injured, pregnant, or sick, has repeated seizures, or has never had a seizure.
Complete this review question to check your knowledge. Hypoglycemia, or low blood sugar, is a diabetic condition that can rapidly develop and become life-threatening. After completing this lesson, you should be able to describe how to recognize and provide first aid for diabetes and hypoglycemia.
Diabetes is a disease in which the body cannot effectively use sugar for energy. Hypoglycemia, or low blood sugar, is a diabetic condition that can rapidly develop and become life-threatening. Signs of dangerously low blood sugar include hunger, shakiness, dizziness, confusion, difficulty speaking, and feeling anxious or weak.
Hey Jerry, time for your break.
Assess scene safety. If the scene appears unsafe, do not approach it. Take standard precautions. Assess responsiveness.
Hey, are you okay?
No. I need to get started on this. I'm not sure how.
Send someone to get the first aid kit and AED. Assess breathing for no more than 10 seconds. Follow the procedure based on your findings. If the person is breathing and appears responsive, obtain consent.
Hey Anna, can you come over here? Do you have your glucose with you?
My coat.
What's up?
I think Jerry's having a problem with his diabetes. Can you run to the break room and grab his coat? He has some sugar tablets in one of the pockets.
If they can swallow without difficulty, encourage them to swallow about 20 grams of oral glucose. Oral glucose is preferred and comes in different forms, including a dissolved solution, gel, spray, chewable tablets, or a wet paste. If not available, use something with dietary sugar instead, such as orange juice or jelly beans. Insulin is not considered an emergency medication. It is never appropriate to administer insulin to a diabetic person in an emergency setting. Regularly reassess scene safety, responsiveness, breathing, and the effectiveness of first aid care provided. If the symptoms do not resolve within 10 minutes, they get worse, or if the person is not able to swallow or becomes unresponsive, call 911 to activate EMS using a mobile device, or activate your EAP.
Complete this review question to check your knowledge. Recognition of the signs and symptoms of presyncope combined with rapid first aid treatment may prevent syncope from occurring. After completing this lesson, you should be able to describe how to recognize and provide first aid for presyncope and syncope.
Presyncope, or near fainting, is the medical term for the feeling of fainting, but without an actual loss of consciousness.
Hey, JC.
How's it going?
Good.
Presyncope can last from a few seconds to minutes. It is typically caused by an unexpected drop in blood pressure and blood flow to the brain.
JC, you don't look so good.
I feel lightheaded.
Common causes include a body's reaction to anxiety, fear, pain, or stress. Syncope is the medical term for fainting, the temporary loss of consciousness due to the sudden decline of blood flow to the brain. Standing in place too long, or rapid changes in position, such as getting up quickly from a seated position, can also result in feeling faint. More serious causes that may not resolve quickly include medications or an underlying medical condition. A person may complain about suddenly being lightheaded and weak. They may describe feeling warm or having blurry vision. You may notice changes in skin appearance and condition.
Why don't you take a seat over on the curb?
If a trained first aid provider recognizes the signs or symptoms of presyncope, the priority is to help prevent injury to the person from falling. Quickly help them get into a safe position, such as squatting, sitting, or lying down. Once in a safe position, encourage the person to perform physically counter-pressure maneuvers, or PCMs. PCMs are movements of a muscle or group of muscles that increase blood pressure. PCMs can relieve the symptoms of presyncope and prevent syncope. Lower body PCMs are preferable to upper body ones because they are more effective at increasing blood pressure. The use of both lower and upper body PCMs at the same time can be beneficial. PCMs are reliable, safe, and effective. If you suspect presyncope, instruct the person in these movements. Cross the legs and tense the muscles of the legs, abdomen, and buttocks. Get into a squatting position and tense the leg and abdomen muscles. Hook the fingers of both hands and pull outward in opposite directions as hard as comfortably possible. Clench both fists as hard as comfortably possible, holding a soft object if one is nearby. Bring the chin down to the chest and tighten the muscles in the neck. The use of PCMs should rapidly resolve signs and symptoms of presyncope. PCMs can also be used for self-care if you feel faint. If the person's symptoms do not improve within 1 to 2 minutes, worsen, or reoccur, call 911 to activate EMS using a mobile device or activate your EAP. PCMs should not be used if more serious warning signs and symptoms are present, such as confusion, chest pain or discomfort, accompanying injury, bleeding, signs of stroke, or breathing difficulty. When responding to a person who fainted, assess scene safety and take standard precautions. Assess responsiveness. Activate EMS and/or EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. Assess breathing for no more than 10 seconds. If an unresponsive person is breathing normally, place them on their side in the recovery position to help protect the airway. After fainting, a person should quickly regain consciousness.
Gordon, are you okay?
Younger.
If the person is responsive and breathing normally, there is no evidence of pain or injury, have them flat on their back. Ask the person to describe the current problem.
Complex. What about your head? How does that feel?
Lightheaded.
Look for medical identification jewelry. Visually assess an injured person from head to toe. Look for deformities and open injuries. Ask about tenderness and swelling. Provide appropriate first aid for any problems found. Regularly reassess scene safety, responsiveness, breathing, and the effectiveness of first aid care provided. Stay with the person until someone with more advanced training takes over or EMS arrives.
Complete this review question to check your knowledge. High temperatures can be dangerous to people at work, home, and play, and can lead to injury, illness, and death. After completing this lesson, you should be able to describe how to recognize and provide first aid for heat-related emergencies.
An environment of high heat and humidity can cause heat cramps, exertional dehydration, heat exhaustion, and heat stroke. Heat cramps are the earliest sign of heat illness. Heat cramps may also be a symptom of heat exhaustion. Heat cramps are hard, tense, and painful muscle spasms of the hands, calves, feet, thighs, or arms. Early and appropriate first aid includes rest, moving to a cooler location, removing excess clothing, including PPE, and drinking a carbohydrate electrolyte drink such as Gatorade or Pedialyte, or water if that is not available. Stretching, icing, and massaging the muscles often provides relief of pain. Exertional dehydration occurs when a person loses more fluids than they take in, and the body does not have enough fluids to work properly. In adults, the symptoms of exertional dehydration include feeling very thirsty, dry mouth, urinating and sweating less than usual, dark-colored urine, dry skin, feeling tired, and dizziness. If the trained first aid provider suspects a responsive person is dehydrated due to a hot environment, encourage the person to rehydrate by drinking a carbohydrate electrolyte drink, or water if that is not available.
Man, you don't look so good. Are you doing okay? I'm going to move you something to drink.
Dehydration can be mild or it can be severe enough to be life-threatening. If the person has an altered mental status or loss of consciousness, follow the adult first aid procedure. Immediately provide appropriate first aid. Heat exhaustion can occur as a combined result of a rising internal temperature and dehydration. Symptoms include nausea, dizziness, muscle cramps, presyncope, headache, fatigue, and heavy sweating. Heat exhaustion is a serious condition because without early recognition and treatment, it can quickly progress to heat stroke, a life-threatening condition.
Hey, are you okay?
No, I'm not doing so good.
Can I help you?
Yeah.
Okay, let's get you out of here. You may be overheated.
Have the person stop any activity and move to a cooler place, preferably an air-conditioned environment. Loosen or remove excess clothing, including occupational PPE. Have the person lie down. Spray water on or apply cool, wet cloths to the head and torso. Use a fan to increase the cooling effect. If the person is able to follow simple commands and swallow without trouble, encourage them to drink a carbohydrate electrolyte drink or water if that is not available. In most cases, the person's condition will gradually get better. If the person does not improve or seems to get worse, follow the adult first aid procedure. Immediately provide appropriate first aid.
Hey, can I get somebody out here to get a bit on the farm right now? I'm not feeling too good. I think I need some water. Is that possible?
Sweetheart, I'll get you some water. Just give me a couple minutes.
Heat stroke is a life-threatening medical emergency with a fatality rate of up to 71%. Heat stroke includes all the signs and symptoms of heat exhaustion, plus confusion, syncope, and seizures. Follow the adult first aid procedure. If a person with suspected heat stroke is unresponsive, not breathing normally, or only gasping, immediately start CPR. If a person with suspected heat stroke is unresponsive and breathing normally, the most important action a first aid provider can take is to begin immediate cooling with the resources available.
He's unresponsive but breathing. I'm going to keep cooling him down. Can you call for help, please?
Do that. I'll call 911 and head over with some water.
It is critically important to bring the person's body temperature down as quickly as possible to reduce the risk of organ injury or death. When possible, begin immediate cooling by immersing the person up to the chin in cool to cold water. If that is not possible or doing so would be unsafe, use other forms of immediate cooling. Apply cold packs to the neck, groin, and armpits. Spray or pour cold water on the person and fan them. Or cover them with a cold, wet sheet and continue fanning. Provide continuous cooling until the person is alert and responsive, or until someone with more advanced training or EMS providers arrive and take over.
Complete this review question to check your knowledge.
Stay tuned for scenes from our next episode.
We do it every night. Every night. I live alone, but I still do it every night.
Do it. Run your dishwasher with Cascade Platinum Plus and save water. One load of dishes in the sink.
A cold or cool, wet environment can result in a lowering of internal body temperature. Hypothermia and frostbite are the most dangerous cold-related conditions. After completing this lesson, you should be able to describe how to recognize and provide first aid for cold-related emergencies.
A cold or cool, wet environment can result in a lowering of internal body temperature. Hypothermia and frostbite are the most dangerous cold-related conditions. Frostnip is the freezing of superficial skin layers. The skin feels numb and looks white. Rewarm the area as soon as possible using skin-to-skin contact.
How's your hand doing? I've been trying to get it warm, but my fingers are pretty numb. I probably should have took the wet glove off earlier.
Frostbite occurs when deep tissues freeze. Body parts that are commonly exposed to extreme cold, such as the fingers, toes, earlobes, cheeks, and nose, are the most likely skin to be affected. Contact with metal accelerates freezing and is particularly dangerous. Early signs of severe frostbite include burning, numbness, and tingling skin that appears white and frozen. Blisters may form. Do not rub frostbitten skin or apply snow or ice to it. Do not disturb blisters.
You need some help? My buddy's glove got messed up. He took it off. Now his fingers are numb. It took us a while to get here.
Can I take a look?
Sure.
Yeah, it looks like you may have frostbite. I can help.
Okay.
If you suspect frostbite, get the person to a warmer place. Remove any wet clothing from the affected area and dry the skin. Remove any constrictive jewelry. Do not rewarm the frozen body part if there is any chance it may freeze again. The thaw-refreeze cycle is very harmful. It is safer to keep the affected part frozen. Place dry gauze pads between frostbitten fingers and toes. If gauze dressings are not available, use any clean material available, such as clothing, a towel, or other material to keep the body part still and protected. If you are more than 2 hours from professional medical care, rapid rewarming is recommended. Immerse the frostbitten area in warm water for 20 to 30 minutes. The water should be 98.6 to 102.2 degrees Fahrenheit, or 37 to 39 degrees Celsius. If a thermometer is not available, test the water temperature by placing your hand in the water for at least 30 seconds to confirm that the temperature is tolerable. Other heat sources, such as chemical warmers, fire, or heated rocks, should not be used due to risk of further injury from thermal burns. Check continuously and keep the water warm at the recommended temperature. Severe pain, substantial swelling, blistering, and tissue color changes should be expected. When rewarming is complete, use bulky, dry gauze dressings wrapped loosely on the thawed parts to protect it and allow for swelling. Elevate the affected body part if possible. Do not let the person use the affected body part after it is thawed. Have the person evaluated by a medical professional as soon as possible. Hypothermia is an abnormally low core body temperature, defined as 95 degrees Fahrenheit or 35 Celsius or less. Hypothermia frequently accompanies frostbite and can be fatal. Signs of hypothermia include shivering, an inability to function well, a decrease in consciousness, or an altered mental status. If there is any doubt, assume that the person is hypothermic. Assess scene safety. The decision to rescue or to provide first aid for a potentially hypothermic person should only be made after the scene is safe. Take standard precautions. Assess responsiveness. Call 911 to activate EMS using a mobile device, or activate your EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and an AED. If a person with suspected hypothermia is unresponsive, not breathing normally, or only gasping, start CPR. Cardiac arrest victims of hypothermia have survived with normal brain function after lengthy CPR efforts. However, do not start CPR if the person has obvious fatal injuries, or if the chest is too stiff to compress.
Are you doing okay? You've been in here for a while. You should step out.
If the person is breathing and responsive, but has an altered mental status, consent is implied. Keep a hypothermic person lying flat. Do not allow them to stand or walk. Handle them gently. Significant movement of the arms and legs can increase the flow of cool blood to the heart and increase the risk of cardiac arrest. Protect the person from further cooling. Use blankets, quilts, sleeping bags, or any available insulated materials. Cover the head and neck to retain body heat. If you are far from professional medical care, gently move the person to a warmer place. Remove wet clothes, preferably by cutting them off to minimize movement. Dry the person gently and cover them with dry insulating materials. Begin actively rewarming the person. Place warm, not hot, water bottles in the person's armpits. Apply a large electric heating pad or blankets to the chest and back. Avoid applying external heat to the arms and legs. Visually inspect the person's heated skin every 20 to 30 minutes for excessive reddening or other signs of impending thermal burns. If signs of burns appear, stop active rewarming in the affected area. Stay with the person until someone with more advanced training takes over or EMS arrives.
Complete this review question to check your knowledge.
Putin didn't mention President Biden at all in his speech. He did say he's suspending this country's participation in the New START nuclear arms reduction treaty with America. We are live around the world this hour. Christiane Amanpour is near the Ukrainian-Polish border. Phil Mattingly is in Warsaw. Matthew Chance is in London. Sam Kiley is in eastern Ukraine. And Tom Foreman is in Washington. Let's get straight to all the latest developments. Our senior international correspondent Matthew Chance has new information about that failed Russian missile test, and our chief White House correspondent Phil Mattingly is traveling with President Biden in Poland. First to you, Matthew. What can you tell us about this long-range missile test that Russia actually carried out while President Biden was in Ukraine?
Yeah, we'll pay